Hi, I'm Dr. Arthur Kwan, and I'm one of the doctors that practice here at Nu Smile Roseville Dental here in Roseville, California. I wanted to take a moment to talk a little bit about TMJ pain and TMJ symptoms that patients go through, a syndrome otherwise known as temporal mandibular joint dysfunction, or TMJD. TMJ pain or symptoms are actually not a funny thing because you have symptoms that are extreme, like headaches, migraines, ringing in the ears, pain in the neck, numbness in the shoulders, arms, all the way down to your fingertips. There's symptoms such as vertigo, where there's dizziness, a host of different things, even including pressure behind the eyes. And sometimes these symptoms can be so debilitating, it really impacts the ability to speak, eat, chew, or even keep your mouth open long enough for dental appointments. So one of the techniques that we employ here, besides doing a very thorough exam, checking out the joints and the bite alignment, is utilization of neuromuscular dentistry. Now, in our practice, neuromuscular dentistry is employed to help properly diagnose and come up with appropriate treatment plans for any given patient, as each patient is very different and unique. When we utilize neuromuscular dentistry to diagnose, we'll utilize a specialized computer known as the K7, made by Myotronics based out of Seattle. And this specialized computer allows us to track jaw movements. It allows us to measure before and after muscle EMGs, otherwise known as muscular EKGs of the jaw muscles, and we're able to track which muscles are overworking or underworking in the case of tension headaches. And when we do these so-called workups, acquiring all kinds of data, this data allows us to determine if a bad jaw position or malaligned bite is the causative agent in this patient's TMJ pain. So when we do these neuromuscular K7 workups, we're able to measure the muscle activity before we do anything. We do a lot of preliminary scans where the jaw is hanging out at in their natural state, how hard the muscles have to work, how their swallow patterns are, and how hyped up the muscle energy is. When we've done our preliminary scans and we're complete with that, we have the patient go through about 45 minutes or about an hour of muscle relaxation utilizing a technique called TENS, ultra low frequency TENS, which relaxes the muscles and rids many of the muscle bundles of lactic acid, which allows the muscles to go from a tight contracted state to a relaxed state. So when we find that at the end of an hour of relaxation and we run those same scans over again, we find that the muscles have gone from a really hyped up state to a more calm state, then that tells us the muscle relaxation did its job and that tight muscles are probably a big part of the problem. So when we place a specialized jaw tracker back on the patient's head, we're able to see if the jaw position has changed or if that lower jaw has moved away from a tight overbite setup to a more relaxed, normalized bite. And when we find that, we're able to actually record where the jaw changes are. And when we record those jaw changes in position, we're able to record the thickness or amount of space that's in between the back teeth and the front teeth. This is then reflected in digital scans, and when we do our digital scans, we're able to replicate how much space needs to be filled in to support this patient's bite by fabricating a specialized lower removable orthotic. This lower removable orthotic is fabricated traditionally from a lab with a heat process acrylic. Nowadays, we're able to fabricate orthotics in office by inputting digital scans and utilizing a specialized program in our lab that can 3D design and send over to our 3D printer to 3D print these orthotics or appliances that look like night guards but are a lot more than that. Once these lower removable orthotics are fabricated and polished and adjusted, we're able to deliver these to the patient, and on the day that the patient returns for receiving an orthotic, we once again relax the muscles by utilizing the TENS to allow the jaws to relax, for the muscles to relax and receive this orthotic. Once the patient receives the orthotic, we adjust it accordingly and allow the orthotic to properly support the jaw position and removing the tension. Generally within the first 48 hours to up to a week, and we'll generally see patients report back while my jaws are not as tense and everything seems to be fitting in, and my migraine intensities or frequencies are starting to go away. Patients generally will wear these orthotics or these removable orthotics over a period of anywhere between 3 to 6 months, and during that period of time of 3 to 6 months we'll fit in multiple adjustments to ensure that as the muscles are healing, the jaw joints will change a little bit, allowing us to make any updated micro adjustments onto the orthotic to ensure that all the teeth are fitting together properly, meaning the upper teeth are fitting against the digitally designed divots on lower orthotic that are shaped just like teeth to fit together like a proper, well-fitting gears in our engine.
So for almost 2 years before I found you, I was going through all this pain and through all these tests and just getting nowhere quick. And I lost a ton of weight. I couldn't eat, and I knew I was gonna die if I couldn't eat.
Yeah.
And I had 2 boys. And so one night, like 1 o'clock in the morning, I was just doing research, trying to find some answers. And I came across a blog of another law enforcement officer, female, and she was going through the same jaw pain and neck pain and everything. And she said she found a really good dentist who had this specialized training, LDI training, and how she was so much better. And I'm like, maybe that's what I need. So I started searching all over Sacramento, and at that time there was 2 people that did it, and I read each dentist's website, and it's like, no, this is the guy for me. So I called up, and the rest is history.
Wow. So you mentioned 2 years that you have been looking for different solutions. Would you say that your symptoms and your discomfort had been prior to the 2 years?
Probably a little bit. I just didn't realize it. I was just kind of going through life trying to
Trying to survive.
Just trying to survive, just getting through every day. And then there was an incident at my work, and I was very weak, and I got down to 89 pounds because I couldn't eat. And my partner and I got in a fight with an offender. We both lived, but I knew then I was gonna die if I didn't eat.
That's.
I'm sorry.
Oh no, you're absolutely fine.
Thank you.
That's so powerful that how that was affecting your life.
And then after that, it's like I knew I had to do something. And I just searched, and I get sharp pains in my eyes, my neck and my shoulders were always tight, and then my back would hurt, and it's a whole domino effect. Before everything, I went to Disneyland with my family, and I couldn't walk because I was in so much pain. I was in a wheelchair at Disneyland with my son.
That's amazing.
And I was, 49 years old then. And I was like, I can't live like this. And then my eating was just horrible. I hardly ever ate any meat. I hardly ever ate any fruits or vegetables. It was always pastas and just soft foods.
Softer foods, yeah.
I couldn't chew. And my back teeth didn't touch each other, and my front teeth would bang each other. It was a mess. And so I couldn't sleep good at night. I was starting to snore. It wasn't.
Quality of life was really hard.
It was.
Yeah.
It was just surviving every day to get through every day.
And that's hard when you've got to run a family with 2 boys and still doing the type of work that you do, which is a very physically demanding type of a position. That makes it really hard when you have a hard time sustaining yourself nutritionally, it becomes really challenging.
Yes. I drank insured drinks, so I remember one time my primary care doctor emailed me. He goes, "You're severely deficient in this vitamin, this certain vitamin that normally people are not deficient in."
So how early in the game would you say, holy cow, this stuff works?
I mean, the very first day I got the orthotic, I knew it worked. And I
Really quick.
Yes. I remember calling my mom, driving home from here, going, "Oh my God, Mom, this works. I don't have pain." And then at night, I started sleeping better. And it was better. I could tell that it was working.
So Shannon, after wearing her lower removable orthotic for many, many months and experiencing pain-free day-to-day life, she reached back out to us and told us that while the lower removable orthotic was great, removed all her pain, she was craving a little bit more. And so when we asked what more she was looking for, she expressed her concern that while the removable orthotic was great for removing pain, she was also expressing concerns that her natural teeth were not the look that she was looking for. And she had asked us what options that we had as far as that was concerned. So many patients that are in lower removable orthotics are what we call phase 1. Phase 1 is generally reserved for pain removal, pain control, and removal of a patient's TMJ symptoms. And I would say 75 to 80% of our patients that go through orthotic therapy stay right there. It's what we call a semi-permanent solution, where removal of pain is the primary motivator. And in this particular case, with the pain all removed, she was craving for changes in the aesthetics and shapes of her teeth. So Shannon had originally presented with a lot of short worn teeth, which led to a lot of her symptoms. Wearing the orthotic removed the pain, but the aesthetics were now a secondary concern. So we proposed that we could do a technique called transitioning her out of a lower removable appliance into something that was a little bit more stable and fixed in the mouth. And we described the process as the space that was filled in by the appliance would now be divided up equally into a mock upper and lower set of teeth, where she could test drive the shapes, length, and looks of the teeth while maintaining the integrity of the jaw separation and support that she had been used to with the removable orthotic. In that instance, she decided to move forward with that proposal as she thought that was what she wanted and needed. We started the process by scanning using a digital scanner to scan her upper and her lower teeth in their existing condition. And we transferred digitally the bite position where her lower removable orthotic had been keeping her jaw stable. The digital scans that we took in the treatment room when Shannon was in the office are now exported into our lab software called exocad. Within exocad, we're able to take into account the desired lengths, widths, and shapes of teeth that Shannon wanted for her ultimate smile makeover. And from there, we're able to digitally design and mock up a proposal that not only fills in the space that the removable orthotic used to occupy to keep the jaw stable, but divide up that space equally between a new upper set of teeth and a new lower set of teeth. We're able to take into account and so this proposal, this digital proposal, is then sent over to the patient for review to see if she likes the proposal. And we're very fortunate that after looking at the proposal, there was not a whole lot of changes, that the software was actually pretty spot on. Once the patient had given us the approval to move forward, we went ahead and 3D printed the models on our 3D printers, which gives us a full mock-up of the shapes of the teeth if they were to be in her mouth. From these 3D printed models, we're able to make a transition matrix that allows us to transfer the shapes that have been digitally proposed into the mouth live. So when the patient returns back for the delivery of the fixed orthotics, the patient shows up, we go ahead and we allow the patient to take out her removable orthotic for the last time. We properly isolate the teeth that were temporarily bonding in this upper and lower arches of test drive teeth. We place the orthotics, clean up any excess, and polish everything up so it's nice and glistening and smooth. And we go ahead and we double check the bite to ensure that it is exactly the same as when the patient was wearing her orthotic, her removable orthotic, that is. So here in this next part, you can see where she's seeing her smile for the first time, looking at these new teeth, and she's just blown away and she cannot believe how good the temporary test drive teeth look like compared to what she had been used to with her original short and worn down teeth.
Are you ready to see? Oh, there we go.
Yeah.
They look really good.
Do they?
Yes.
They look like real.
Oh my god. My teeth are like straight. They're not.
And big, right?
No, no need to apologize. No, you're totally fine.
Wow. So happy for you too. That's her. We're happy to. Oh my gosh. You deserve this.
You're very welcome.
So welcome. So welcome. You don't have to say anything.
Normally I always have something to say.
They were in your position 6 years ago, who would be experiencing maybe some symptoms similar to what you went through before you found someone to help you address your symptoms, what would you tell them if they were looking for a solution?
I even told some of my coworkers that have jaw tension or something, don't do what I did. Get this taken care of now. I wish I would have found you earlier, but it's worth it. Absolutely, I would do it and take the first step and just get it started, and you will not have any regrets at all.